Okay, good afternoon, class. So for today, we're going to start our semester with the discussion about homeostasis, stress, and adaptation. So let's start with this term first, homeostasis. When we talk about homeostasis, this means a steady state, or there's a dynamic balance or equilibrium. So that means that there is a balance, the body is in a stable state, or it's in an equilibrium, or the stability of the internal environment, which is our body, was coordinated by homeostatic or compensatory processes that responded to changes in the internal environment. Any change within the internal environment initiated a righting response to minimize the change. These biologic processes sought physiologic and chemical balance and were under involuntary control. So this was described by Walter Cannon with regards to what homeostasis is all about. So it means that the internal functioning of our body, the internal environment is stable. And just in case there's some imbalance that is going to happen, the body will somehow correct itself eventually. If there are any physiologic or any chemical imbalance that were somehow out of control. So these are the homeostatic regulators of our body. We have the autonomic nervous system. So that includes the cranial nerves, thoracic nerves, lumbar nerves, sacral nerves. The endocrine system, we all well know the different organs for the endocrine system, the pituitary, thyroid, parathyroid glands, the pancreas, and our adrenal glands. And some specific organ systems, such as that of the respiratory system. Our cardiovascular system is also included there in the homeostasis. The GI, or the gastrointestinal, and lastly, our renal system. They are all involved in maintaining the body's homeostasis. Now, one of the things that we need to discuss in this subject is all about stress. When we talk about stress, this is a state produced by a change in the environment that is perceived as challenging, threatening, or damaging to the person's dynamic balance or equilibrium. So that's what stress is all about. It will challenge us. It's one of the things that we encounter in our everyday lives. So it will be challenging for us. Some of them, or sometimes it can be life-threatening, or it will be damaging to our balance or equilibrium. So we experience this every day. So when we talk about eustress, when we say you, meaning that is somehow a good thing, it's a normal thing, like just in case in pneumonia, it's normal respirations. But here, eustress, positive level, it indicates a positive level of stress. It's a non-specific stress response associated with desirable events such as marriage. So if you got married, you're going to feel this eustress. It's a positive level of stress. Or if you got promoted in a job, or if you're working, you got your bonus in your job. Or if you're still studying, if you got high scores from your exams, then you are going to experience this positive level of stress. But for distress, this one is the negative level. And it is subjective response to internal or external stimuli that are threatening or perceived as threatening to the self. So that's the thing that we sometimes feel. We feel distressed whenever certain challenges approach us in our day-to-day lives. And according to Hans Selye, stress is a response to an environmental demand or stressor or stress-inducing demands. So the environment usually is the one causing us stress. We somehow respond to it It depends on our body on how we respond to this stressor that came into our lives. So that's the definition of stress according to Hans Selye. Now, there are different types of stressors. We have physiologic and emotional or psychologic stressors. We'll start out with the physiologic first. The different types of physiologic stress can be skin burn, for example, chronic pain, hypothermia, infectious disease, excessive noise that that will not make you sleep, especially if you hear that noise at night. If you hear people singing the video key karaoke at night, this can be a stressor for you. Starvation can also be a stressor, because if you feel starved, if you're very much hungry, of course, this will disturb you. Or even running a marathon. So this will give you stress on your body. But for emotional or psychological stress, if you are diagnosed with cancer, that can cause this kind of stress, emotional, or if you have marital problems with your partner, or even failing an examination as a student, or let's say inadequate financial resources to meet your needs. So you lack the money to buy your everyday needs, or there's a death or a loss of a family member. If you are grieving, so it's an emotional stress. Or if you're taking care of a disabled child in a family, that can also be an emotional stress. Winning or losing an athletic event can also be an emotional stress, or even winning the lottery. But that is more a positive response or positive emotional stress. Adaptation. This is an adjustment to change to restore our equilibrium, and also a process of coping with stress, which is both physiological and psychological component. So this is how we somehow adjust to certain stressors that we are confronted with, on how we adapt to these stressors that have been presented to us. So this is what adaptation is all about. And it is an ongoing process that requires adjustment in structure, function, or behavior to better suit the changes. So once we have been presented with a problem, which is a stressor, we somehow deal with it by making certain adjustments. Let's say, for example, if you are already late to class and there's heavy traffic along the way, so what are you going to do? You're going to make some adjustments. Either you're going to message your instructor that you're going to be late, or you're going to get off the car or the vehicle that you're riding and run all the way to school if the school is just nearby, already nearby. So these can be some adjustments that you can do if you're presented with some kinds of stress. It's also an ongoing process of modifying one's behavior in changes, circumstances, or an altered environment to fulfill psychological, physiological, and even social needs. So we are constantly adapting to the changes that we are encountering in our lives. Whenever a change has occurred, let's say, for example, you have transferred into a new home, this can be a stressor for you because you need to unpack things, arrange things again, and so on. You need to adapt to where you are currently located because everything's new for you. So that's what adaptation is all about. Now we go to the GAS or General Adaptation Syndrome. This consists of processes that are normal responses and are considered as adaptation measures to help people cope with the immediate threat. And it has 3 stages: the stage of alarm, stage of resistance, and stage of exhaustion. So this is how we deal with the stressors that we are confronted with in our day-to-day lives. It's an adaptation measure. if there is or we are presented with an immediate threat. And always remember these three stages: ARER, alarm, resistance, and exhaustion. In the first stage, alarm, the alarm reaction, here the individual perceives the stressors physically or mentally, or this response is initiated known as the fight or flight response. So let's say, for example, you're experiencing fire. You saw that there's a fire in a building. You're going to be alarmed by this fire. So our fight or flight response is going to be triggered. It's going to be initiated. So that's what the alarm reaction is all about. And it leads to a series of physiologic changes that promote adaptation. So in the alarm state, usually what happens here is there's a temporarily decrease that temporarily decreases the individual's resistance. And sometimes in the alarm stage, since the fight and flight response is triggered, the vital signs here at this stage usually shoot up, they increase. Manifestations of the alarm stage. First is increased secretion of corticosteroids and resultant changes. So, like what I've said earlier, there are certain organs, such as the adrenals, that will secrete corticosteroids such as epinephrine. So when our fight and flight response is triggered, that is the first thing that is going to be secreted, corticosteroids. And there will be an increase in the activity of the sympathetic nervous system. Increased norepinephrine secretion is also done by our adrenal medulla. The fight or flight response is triggered, and there's a low resistance to the stressor at this stage. Next is the resistance stage. Here in this stage, this is a physiologic or the physiologic reserves are mobilized to increase the resistance to stress. So this is the time where we resist whatever that stressor or whatever stressor is present among in our way. And what happens here is we are expending energy in an attempt to adapt. And at this time, adaptation may occur. So we're going to somehow deal with the thing that is currently threatening us, either deal with it positively or negatively. If adaptation may not occur, the person may move to the next phase if that person deals with it negatively. But we should deal with it positively. And now we go to the manifestations of the resistance stage. Corticosteroid secretion returns to normal. So it will return to normal, unlike that of the alarm stage, it is increased. Sympathetic activity also returns to normal. Norepinephrine secretion also returns to normal at this stage. Fight or flight response disappears. And now, since before there's a little to no resistance to that stressor, now there is high resistance to the stressor, since this is the resistance stage. The last stage, the exhaustion stage, this occurs when all of the energy for adaptation has been expended. So if you've used all of the energy that you need for a certain stressor that you have been presented with, what happens when you enter into the stages, the individual usually becomes ill or may die if assistance from the outside sources is not available. And it can be reversed by external sources of adaptive energy, such as medication. Next, manifestations of exhaustion stage. There's increased corticosteroid secretion, but eventually marked decreased secretion may occur. And the stress triad, there will be hypertrophied adrenals, atrophied thymus and lymph nodes, and bleeding ulcers in stomach and the duodenum. Loss of resistance to stressor may eventually lead to death. So we should not go into this stage. Now, with the physiologic response to stress, with the nervous system, our cerebral cortex evaluates the emotional psychologic event or the stressor. That's what we do. We analyze what is currently happening. And our limbic system, this is an important mediator of emotions and behavior, since when it is stimulated, emotions, feelings, and behaviors can occur that ensure survival and self-preservation. So it's also stimulated during a stress response, that limbic system, because it is the one that is involved in our emotions and how we behave during a stress event. While the reticular system, or the reticular formation, which contains the reticular activating system, the RAS, when this is stimulated, there's an increase of its output of impulses, leading to wakefulness and can lead to sleep disturbances. So once our fight and flight is triggered, it's the responsibility of RAS to keep us wakeful, for us to be alert and not to be sleepy. I've experienced this before. That was way back when I was in high school, I think, when the neighbors knocked on our doors saying that the flood is already coming. That was around 2 a.m. So what happened was the whole family was awake. The flood is already coming in to our home at that time. We need to move the furniture, the appliances, or else the furniture and appliances will be ruined by the flood. So we were awake early at 2 a.m. in the morning, as early as 2 a.m. And we were awake the whole time since our fight and flight response was triggered at that time. Another gland or the organ, hypothalamus, the limbic system stimulates the hypothalamus at this time during fight and flight response, because our hypothalamus secretes hormones that are responsible in the regulation of the release of the hormones from the anterior pituitary, which is central to the connection between the nervous and endocrine systems in responding to stress. Remember, the pituitary gland is the master gland of all the glands of the endocrine system. Without the pituitary gland, the rest of the organs of the endocrine system is not going to work, because the pituitary gland is the one influencing, most especially our adrenal glands, to release the corticosteroids. It's the pituitary gland that secretes the adrenocorticotropic hormones. Adrenocorticotropic hormones, once they are released, it will tell the adrenal glands to secrete corticosteroids. So here, the hypothalamic pituitary adrenal axis. I'll explain this further. Once stress is present, the hypothalamus is going to be activated. There's hypothalamus activation, and it will branch out into two. We have the corticotrophin releasing hormone, or the CRH, which will in turn influence the anterior pituitary gland to be activated. While the other branch, there will be the sympathetic nervous system activation, which in turn is going to stimulate the adrenal medulla. After which, we'll go to the first branch. Once the anterior pituitary gland is activated, it will release pro-opiomelanocortin, or POMC. I'll repeat that, pro-opiomelanocortin, which in turn will release the adrenocorticotropic hormone, and beta endorphin. It's a neuropeptide that has an analgesic-like effect. Once ACTH is released by our anterior pituitary gland, it will influence the adrenal cortex to release or secrete corticosteroid or cortisol. While in the other branch, once the sympathetic nervous system activates or stimulates the adrenal medulla, it will influence it to release or secrete or produce catecholamines, such as epinephrine and norepinephrine. So this is the pathways on how the hypothalamus influences the pituitary gland, so that the pituitary gland will influence the adrenal glands to secrete the hormones that are needed during a stress response. Now, physiologic response to stress. We continue with this. With the immune system, the psychoneuroimmunology, PNI, it is an interdisciplinary science that seeks to understand the interactions among psychologic, neurologic, and immune responses. So they're studying about the psychologic effects, neurologic effects, and immune responses during a stress event. Immune system. Continuation of this. Acute and chronic stress affect function. There will be a decreased number and function of natural killer cells, altered lymphocyte proliferation, decreased production of cytokines such as interferon and interleukin, and decreased phagocytosis by neutrophils and monocytes. So if we are constantly under stress, it can greatly affect our immune system. So the immune system is going, or the function of the immune system is going to decrease because we are constantly triggered by stress, and it can affect this system. Now, the effects of corticosteroids, once they are produced, they increase the blood glucose levels and inhibits the inflammatory response to occur. So it suppresses the release of pro-inflammatory mediators such as cytokines, tumor necrosis factor, or the TNF, and interleukin-1, IL-1, and there's immune system depression. That's why if we are constantly under stress, let's say, for example, you're a female who is constantly stressed with your partner, with your spouse, you're going to die of stress later on, because what is going to happen with your body? Your body's immune system is going to go down, and how is this body going to fight off infection and other invading microorganisms or even cancer cells later on because of stress? That's why sometimes if a person is constantly stressed, this can trigger certain cancers to come out later in life. And that is very, very true, because there are certain cancers that will arise once a person is constantly stressed. So guys, make sure that you marry someone that will not give you stress every day, because if you're every day stressed by your spouse, you might have certain diseases or disorders later on. Now, effects of stress on health. Cognitive function. You'll have poor concentration, memory problems, distressing dreams. So you'll have nightmares. You're stressed. You'll have sleep disturbances. You can't sleep. And you might have impaired decision making. For behavioral problems, you are going to withdraw yourself from your friends, from others. You will become very quiet or unusually talkative. It depends on you. If you're the talkative person, or you are the quiet type of person. You change your eating habits. Some do not eat, while some do stress eating. Some will also drink alcohol excessively. So there are some people who are like that, or they become irritable. Physiologic effects of stress on our health would be the risk for cardiovascular disease and hypertension due to long-term exposure of catecholamines. So if you're everyday stressed by a family member, your spouse, for example, this can be the end result. Or you can have migraine headaches, irritable bowel syndrome, and peptic ulcer, because one of the factors in the development of peptic ulcer disease is also stress. Diabetes mellitus can also arise due to the buildup of catecholamines and corticosteroid effects. Remember, once corticosteroids produce, there will be an increase in the blood glucose. And stress-induced immunosuppression, which you are going to risk yourselves from having infections, such as the common colds. Coping. So for coping, this is a person's cognitive and behavioral efforts to manage specific external or internal stressors that seem to exceed available resources. So this is how we cope with the stresses that we are confronted with in our everyday lives. And this is how we manage these stressors, how we confront them later on. Positive coping includes activities such as exercise or use of social support. So for example, if you had a fight with your boyfriend or girlfriend, of course, you'll be sad about it. Or if you broke up with your girlfriend or boyfriend, or you had a fight with your spouse, positive coping is by talking to your friends, use of social support, or exercising. Negative coping, which is a maladaptive behavior, can be done by, let's say, for example, your spouse is your problem. You're going to take in drugs instead, like cocaine or injection of narcotics, or you're going to deny what is currently happening in your life. There are certain people, married people, who constantly deny that they have a problem and they're not working it out. Instead of fixing what is wrong in a person's marriage, they're just denying the existence of a problem, which can further worsen later on. Or sometimes it can lead later on to suicide if they have poor coping mechanisms. And this is how we are going to avoid these things. You have your psychiatric nursing later on to discuss about this. So one of the negative effects of coping would be this, suicide. Coping strategies. Emotional focused coping. This involves managing the emotions that an individual feels when a stress event occurs. And for emotional focused coping, here, from the word itself, we are focusing on the patient's emotions. We should let the patient talk more about that incident that has caused him or her stress. Problem-focused stress, here we are trying to find solutions to resolve the problems causing the stress. So we give the patient choices, what to do. For example, her stressor is her spouse, her husband. She should figure out things on their own. We offer choices or options in order for the patient to deal with the current problem that she has in order to resolve the stress that she currently has. Environmental stress. Hospitalization can be a stressful experience for anyone. Of course, we're not comfortable inside the hospital. It's an unfamiliar environment. There are multiple stimuli in the hospital, and contacts with numerous hospital personnel, such as the doctor, the nurses, the medical technologists, the radiologists, and so on, can lead to exhaustion and confusion. Nursing diagnoses for stress. One is ineffective coping, most especially if the patient is dealing with stressors negatively. So it is defined as the inability to form a valid appraisal of the stressors, inadequate choices of practice response, and or inability to use available resources. So for example, a patient, let's say, broke up with her boyfriend. The nursing diagnosis that you can give, or ineffective coping rather, is shown if the patient no longer eats, no longer sleeps, constantly sad, and so on. This is ineffective coping. Next, compromised family coping. This refers to usually supportive primary person, family members, or a close friend providing insufficient, ineffective, or compromised support, comfort, or assistance or encouragement which may be needed by the patient to manage or master adaptive tasks related to the health challenges or challenge. So the usually supportive primary person, for example, provides the insufficient or ineffective means of how the patient is going to cope up with his or her stressor, because they need positive encouragement, assistance, and comfort. But the primary person, let's say for example, your mother, you turn to your mother for comfort, for assistance because you're currently stressed with your spouse, and your mother will blame you for what happened. So that's compromised family coping. So that's not good for the patient to endure. So that's one of the nursing diagnoses that we can do. If, for example, the family or friend of the patient is not supportive with what the patient is currently experiencing. Now we go to cellular adaptation. This is structural and or functional changes in response to stress, which can be hypertrophy, atrophy, hyperplasia, dysplasia, and metaplasia. Because cells possess a maintenance function, these are activity cells must perform for itself, and specialized function, which are activities cell performs in relation to tissue or organ from which it is a part of. So we'll discuss the following terms here. Now for hypertrophy, this is an increase in cell size leading to increase in organ size. So cause of having a hypertrophy, prolonged and increased workload. And usually examples of tissues or organs that are commonly affected by hypertrophy would be our muscles. Skeletal muscles, for example. So a positive hypertrophy can occur is most especially if you're working out like me. You've been using weights in workouts, and you've been constantly doing them, carrying weights during workout. Your muscles, the skeletal muscles, are going to hypertrophy, or they're going to increase in size if you exercise them every day for a long period of time. Let's say, for example, you've been doing them for 6 months now, for a year now, you will observe that your muscles will grow. But a negative hypertrophy can occur if the cardiac muscles are the ones involved. It means that your cardiac muscles are getting tired because this can be an abnormality later on if the cardiac muscles hypertrophied. Why is it going to happen? Because why is this happening rather? Because there is an increased workload of a certain chamber of the heart. It's either the right ventricle or the left ventricle. There is a problem with the capacity that the ventricles are having. There's an increased volume of blood brought about by disorders of the heart that you've learned from last semester. Let's say, for example, there is ventricular septal defect, atrial septal defect, and so on. The certain ventricle that is involved will grow in size, will hypertrophy, and this later on can lead to the development of heart failure. Now we go to atrophy. This is a decrease in cell size leading to a decrease in the organ size. So it became small. If you have a disease or it's a part also of an aging process, you have a decrease or loss of blood supply, loss of nerve supply, or inadequate nutrition, most especially inadequate nutrition. Like, for example, patients who have, let's say, anorexia nervosa, you'll see a decrease in size in the muscle mass. So they'll become very, very thin, very emaciated. So the organs or tissues that are affected would be secondary sex organs in aging persons. But for persons who are malnourished, it's either nutritional because they don't have the resources to eat food, or psychological because of anorexia nervosa. You'll see that their limbs, their faces are going to be atrophied, they're emaciated, or brought about by certain diseases such as polio. You can see that their lower limbs are atrophied. Or let's say, for example, if the patient becomes paralyzed, there is paraplegia, paralysis of the lower half of the body. They can no longer use their lower half of the body, the lower limbs. What happens then is, since the muscles are no longer being used, they are going to be, or they are going to have an atrophy. Next is hyperplasia. This is the increase in number of cells leading to enlargement of a tissue mass. It can be normal or abnormal. It can be brought about by hormonal influences or some idiopathic causes or unknown causes. Example of hyperplasia is breast changes during puberty or pregnancy. So the breast is going to be enlarged because of hyperplasia, or the regeneration of liver cells as well, if there's a liver disease. Or in the case of goiter, there will be an enlargement of the thyroid gland brought about by goiter. So that those are examples of hyperplasia. Now, dysplasia. This will occur if the cells grow in different size and shape and arrangement from cells of its own type. This brought about by chronic irritation. This can happen in the epithelial cells of the bronchi, skin, and the cervix. Dysplasia can occur, and this can later on lead to cancer. Say, for example, you constantly irritate your lungs with smoke through smoking cigarettes. This will result later on in dysplasia. Or for white people, if they're constantly exposed to the UV rays of the sun, they will have this as well. Or for a sex worker, they have different sex partners. Every now and then, they can have dysplasia of the cervix, or brought about by this can lead later on to cervical cancer. Remember, one of the factors of cervical cancer is multiple sex partners. Metaplasia. This is the transformation now of highly specialized cells into less specialized cells. This is stress applied to highly specialized cells. So earlier we've discussed dysplasia because of constant irritation. This will now transform. This is what I was talking about earlier. And these epithelial cells will change. Like example, the ones in the bronchi, brought about by chronic smoking. So if you're constantly irritating your epithelial cells of the bronchi, it will first develop into dysplasia. Later on, that will lead to metaplasia. So that's dangerous because afterwards the patient will have lung cancer. So that's it, guys, for the discussion about homeostasis, stress, and adaptation. If you have any questions about my lecture for today, just please send me a message and I would be more than grateful to answer them for you. So thank you very much for attending today's lecture. Have a great day, everyone, and please wait for my next lecture about pain and pain management. Thank you.